Ringing in ears, 8 common causes. The auditory phenomenon referred to as tinnitus, characterized by means of chronic ringing, buzzing, or buzzing sound within the ears, is a complicated and often misunderstood experience. As people grapple with this inner symphony, knowing the diverse array of things contributing to tinnitus turns essential. In this video, we explore 8 common reasons behind the enigmatic ringing within the ears and delve into the multifaceted nature of this auditory mystery. Let's start. Number 1. Exposure to loud noise. In the bustling symphony of current existence, exposure to loud noises emerges as a prominent conductor of tinnitus. Prolonged publicity, be it inside the clamor of a place of work, the crescendo of live shows, or the explosive echoes of leisure sports, like taking pictures, can orchestrate harm to the delicate hair cells within the inner ear. These hair cells, essential for transmitting sound signals to the brain, succumb to cumulative damage, manifesting because the persistent ringing or buzzing, a trademark of tinnitus. As our auditory world grows louder, the need for protective measures, like earplugs or ear muffs, becomes more and more needed. Number 2. Age-related hearing loss. As the chronicles of time unfold, so too does the narrative of age-related hearing loss. Presbycus, the slow decline in listening to capability accompanying the getting older manner, reshapes the auditory panorama. Structural modifications in the internal ear, such as the lack of important hair cells, mark the passage of time. This metamorphosis frequently introduces individuals to an inner symphony of ringing or buzzing sounds. The melodic accompaniment of tinnitus, understanding and navigating this age brought about the auditory transformation, emerge as crucial within the pursuit of concord. 3. Medical conditions. Tinnitus, corresponding to a diffused overture, can usher in the presence of underlying medical situations. Meniere's sickness, with its elaborate choreography of vertigo and hearing loss, performs a big position. Ear infections, stealthy intruders within the auditory realm, can inflict harm and make a contribution to the symphony of tinnitus. TMJ issues affecting the jaw's orchestration add their particular cadence to the auditory narrative. The harmony of health needs a cautious dissection of these primary concerns for a surely resonant decision to the auditory mystery. 4. Medications and ototoxic substances. In the pursuit of recuperation, a few medicinal drugs inscribe an unintended discord within the auditory rating. Antibiotics, non-steroidal anti-inflammatory tablets, NSAIDs, and chemotherapy marketers with their ototoxic signatures behavior harm in the delicate ear systems. The symphony of ototoxic manifests as tinnitus, creating a nuanced interaction between medicinal interventions and the auditory overture. Furthermore, substances like alcohol and nicotine search for solace or delight, might also contribute their own lines to the composition of tinnitus, including yet any other layer to the intricate symphony of causes in the back of the persistent ringing inside the ears. Head and neck injuries. In the unpredictable ballet of life, trauma to the pinnacle or neck emerges as a massive choreographer of tinnitus. Whether springing up from injuries, falls, or the effect of sports accidents, those events can disrupt the delicate systems of the inner ear. The effect is a dissonant observe inside the auditory symphony, a chronic ringing or humming that becomes the aftermath of physical upheaval. The intricacies of the auditory system are prone to the actions of existence, and expertise the effect of head and neck injuries turns into essential in orchestrating a direction to equilibrium. Vascular issues. Within the complicated circulatory system, a discordant rhythm may additionally have an impact on the auditory composition. Conditions affecting blood flow, which includes excessive blood stress or turbulent move near the ears, conduct their very own verses in the symphony of tinnitus. The ebb and flow of blood may also orchestrate a symphony of inner sounds, a subtle but continual hum or ringing. The vascular intricacies inside the auditory realm underscore the need for a complete information of the frame's circulatory nuances in the pursuit of concord. Eustachian tube dysfunction. In the anatomical theater of the ear, the eustachian tubes play a crucial position in regulating strain. Dysfunction in these tubes introduces a dynamic of imbalance, disrupting the equilibrium of stress in the ears. The result is a cacophony of inner sounds, an unwelcome addition to the auditory repertoire. Understanding the position of these tubes and keeping concord within the auditory environment becomes critical in orchestrating a resolution to the multifaceted reasons of tinnitus. 8. Stress and anxiety. The mind, a powerful conductor of bodily symphonies, performs a great position inside the auditory overture of tinnitus. Stress and anxiety, the emotional crescendos of life, can enlarge the notion of inner sounds. This problematic interplay among mental health and auditory belief provides a layer of complexity to the symphony of tinnitus. A holistic approach to control, addressing not most effective the auditory manifestations, however, additionally, the emotional crescendos will become vital in composing a harmonious resolution to the persistent ringing within the ears.